Cancer. What do we really know about it? Well, we know it will affect 1 in 3 people during their lifetime, a staggering statistic. In fact, there are more than 200 types of cancer. The good news is we're learning more about its prevention and treatment every single day. Most importantly, survival rates are going up all the time, and there's plenty you can do to aid your recovery.
It seemed like, days were weeks by the time all the pathology tests came through, with some setbacks along the way. Once they had finally labelled the disease and given me a course of action, that was almost a sigh of relief when we could get started.
Cancer is actually a group of diseases, and the main things about a cancer are that it can grow into a lump, that it can spread from one place to another, and that it doesn't follow the normal bodily controls that we have to maintain good health. We name a cancer for the area it comes from. So, for example, a cancer that grows in the breast of breast origin will be called a breast cancer wherever in the body it goes to. And this is an area that causes confusion quite often for patients, that breast cancers can go, for example, to the bones or to the liver, and that isn't bone cancer or liver cancer, it's breast cancer in those places. Cancer can occur in anybody, but it does have a couple of peaks. There is a peak of cancer incidence in early childhood, for which we have very good treatment results. And then cancer increases with age, so that as the population increases in age, so the incidence of cancer will increase. However, the reason for that is that the body accumulates multiple abnormalities that it is more difficult to repair as the body gets older. There are many myths about cancer, and often this makes patients very worried and frightened. And so the best thing to do if you hear a story about a cancer, or if you're worried about one of these potential myths, is to ask somebody. Your oncologist will always be happy to answer questions on any subject relating to cancer, and there's lots of information available from support groups such as the Cancer Council. One of the major myths about cancer is that it's catchable, and that visiting a patient with cancer could put you at risk of catching cancer. This myth is absolutely false. People with cancer are not what we would call contagious. It's perfectly safe for you to visit a patient with cancer. It may be stressful because talking to people with cancer about their cancer and not knowing how upset they will be is a difficult thing to do, but it's perfectly safe. There is good news in cancer. Every year that goes by, more cancers become treatable and more cancers become curable. We are making definite advances. On a daily basis, those advances look very small, but when you look back over the last 15 or 20 years, the advances have been considerable. More people are surviving most cancers every year, so that even though the incidence of cancer is increasing, so is the survival. And many people are living for a long time with their cancers, even if they do eventually die from them. So that cancer has become a more chronic disease, and in some ways it should be less frightening. However, the very word cancer is so scary that it takes a long time for people to realise that they can live with it for such a long time. If you need more information about cancer, whether it's for yourself or for a friend or family member, there are many places you can find that information. Your GP will always have information about cancers. The hospital where the patient is being treated will have information. And at every cancer centre we have lots of different people that can give you information. There are the doctors, but sometimes people are a little frightened of asking lots of questions to their doctors. But be reassured, the nurses are wonderful and have fantastic amounts of information. There are also social workers and psychologists who can provide extra sorts of information on things that you may not wish to discuss with your medical practitioners. However, beyond all of these, there is also the Cancer Council that has a helpline dedicated to providing support for cancer patients, and it has a wonderful website with lots of other information and links to further websites that are known to be safe and provide good information.
When people first contact the helpline, sometimes they may be just ringing up for information, and that's the way they're able to make that first call, to be able to have a specific question they're asking about treatment or a diagnosis, that sort of thing. And the nurse health counsellors on the helpline are able to firstly answer that question, but then provides a gateway into be able to exploring what else is happening, how are they feeling about the diagnosis, the treatment. And so it provides an opening into that world of the emotional side. And so for some people, their information is what they're looking for, and that's very easily addressed. Other people are looking to actually talk about how this is playing out in their lives. And so to be able to have a conversation on the helpline is really fantastic. But sometimes people are looking for more than that. They're wanting to have ongoing contact. They're wanting to meet with a counsellor to really tease out the complexities of what they're dealing with. And so then they will come to the counselling service and meet with one of the counsellors on a one-to-one basis.
Cancer can cluster in families for two main reasons. The first reason is that cancer is very common in Australia, and about 1 in 3 people can expect to experience some form of cancer in their lifetime. So it's not unexpected for families, particularly if they're larger families or they have a number of members who are older, to have several people who've experienced cancer. But about 5 to 10% of cancer is an inherited or familial form of cancer, which means that the cancer runs in the family. The sorts of things that we see in families that make us suspect that a cancer may be familial or inherited is a number of individuals in the family experiencing the same or a similar cancer, usually 3 or more people. Cancers occurring at an unexpectedly young age, for example, breast cancer in women under 50, but particularly if they're under 40 or under 30. Unusual cancers, some forms of thyroid cancer, for instance, are much more likely to be familial than other forms of cancer. In some families, we already know about a cancer predisposing change or mutation in a gene, and those are families which we would say have a familial form of cancer. Also, individuals who experience more than one different type of cancer, particularly when they fit known patterns of relationships of cancer types. For example, breast and ovarian cancer occurring in the same individual, or bowel cancer and stomach or gastric cancer occurring in the same individual. There are benefits for both individuals and families by recognising a familial cancer syndrome as in the family. For individuals, they can modify their lifestyle to reduce their risk of cancer. They can adopt surveillance strategies so that cancer is diagnosed early when it's easier to treat. And depending on the type of cancer in the family, individuals can also choose to have risk-reducing surgery or other risk-reducing strategies to decrease their risk of experiencing cancer. The process or pathway to seeing a familial cancer service to be assessed for a familial cancer syndrome is relatively simple. A referral from a GP or a cancer specialist or cancer service to your local familial cancer unit is all that is required. Depending on the state you're in, the detailed processes may be slightly different, but in South Australia, the initial information sent by the doctor is assessed, and individuals are usually sent a family history form so that they can provide some interim information about the cancers in the family. If it looks likely that a familial cancer syndrome is involved in the family, then that person will be sent an appointment to be seen.
My sisters and I, we all had genetic counselling, and we also had genetic testing done. As yet they haven't identified my gene, but for the sake of my sisters, and I've got a daughter, for the sake of them, I'm hoping that in time, with technology being what it is, that they'll actually identify what the gene is and be able to offer them some medication or whatever they need to stop, them obviously getting this disease. I'm also part of the Gene Talk. They send me newsletters regularly, so I'm updated on what's happening and, technology-wise, what they're doing as well. And I know it's not going to help me, but if it helps somebody else, then hey, go for it. They can do what they like with my blood sample, as long as they, find a cure for it, we'll be very happy.